I'm going to demonstrate how to do an intradermal skin closure. In this pattern, it's going to be sutured from dominant to non-dominant hand. So because I'm a right-handed surgeon, you'll see me suturing from right to left. If you're a left-handed surgeon, you should suture from left to right. You'll also notice with the thumb forceps that I'm not reaching across and grabbing skin tissue. This causes a cluster of bruises around the tissue in the live patient. Instead, you'll see with my thumb forceps closed that I might be picking up or pushing down on the tissue rather than reaching across and grabbing it. I'm going to bury a first knot for my pattern. So I'm going to reach in, and in this case, I'm actually going to grab some sub-Q here instead of some skin. So my first bite is going to be deep, and deep in this pattern means in the sub-Q, to superficial. And superficial is going to come out through the cut edge of the skin. When I do that, then I'm going to take this tail end, the short end, and point it towards the middle of the incision. Then I'm going to come on the side opposite, and I'm going to go in superficial through the cut edge and out deep in the sub-Q. And I'm going to draw the needle end up next to the short end so that the two are adjacent to each other. And then I'm ready to tie. I'm going to tie just with square throw since I have no tension on closure. And I'm going to pull parallel so that the knot goes in between the tissue layers. And then I'm going to cut my suture ends nice and short, so about 2 to 3 millimeters in length only. This pattern is similar to the subcutaneous, how you start. In the subcutaneous layer, you would take another half bite on your near side. You don't need to do that in this pattern. For the intradermal pattern, in the models, I start just after the knot and take 2 small stitches to start. That pulls the tissue over top of the knot. In the live patient, some surgeons will choose to go back behind the knot for the first stitch. Because the model doesn't stretch as much, I'm going to choose to not do that in this one. You can start either side of the patient to start. I'm going to start on my near side today. And the bite is in and out through the cut edge of the tissue. Then I'm going to go on the side opposite, in and out through the cut edge. And then with each stitch, I'm just going to pull so the tissue opposes. I'm going to come straight across for these bites, not forward or down the incision. That can cause some gapping in the pattern. So when I look down from above, my throws should be pretty much straight across. When it's time to bury your final knot, and I'm going to go ahead and do that now for the sake of time, you're going to build a deep loop. You're going to do that by going superficial to deep on the near side, on the far side, and drawing the needle up in the center. I'm going to pull this throw down because this is not a deep loop and I don't want to get confused and tie to it later. Then I'm going to come on the near side, deep to superficial. And then I will have created my deep loop. So this loop is going to get saved. So I'm going to tie to it next. And then my last stitch, I'm going to come on the side opposite and go superficial to deep. And draw the needle up in between the 2 loops so that this is a deep loop and a superficial loop, and the needle end comes up in the center. I'm going to pull down the superficial one so that I have left the deep one. Before I tie, I'm going to ask myself 3 questions. Is it a deep loop? Which it is. Is it a deep end? Yes. And are they immediately adjacent to each other with nothing in between? As long as that's the case, I'm ready to tie. You could go ahead and tie this with square throws, or you can do an Aberdeen. So I'm going to show you how to do an Aberdeen knot today. This can be helpful because it helps it to bury a little bit easier. It creates a less bulky knot. In order to do an Aberdeen, you're going to reach through the loop and grab the long end, and then pulling down the first loop, create a second loop. So that's 1. Then I'm going to reach through and do it again. 2, 3, 4. And in each case, I'm pulling these loops down nice and snug so there's no airspace in the knot. After 4, I'm going to take the needle end and pass it through the loop And then I'm going to pull the loop down so that all I'm left with is my needle end. When you do an Aberdeen, you do have to do what's called smurfing the end. So what I do is I hold up gently on the knot, and then I'm going to pass the needle down just behind the knot. If I were at the end of the incision, I would come out just past the incision. Since I'm not there, I'm going to choose to come up on my near side just for the sake of convenience. I'm going to go deep down into the sub-Q here, and what it does is it flips the knot upside down and makes it disappear, and then I'm going to cut level with the skin.